There are two things that attract me to this specialty. And one is the human approach, what I call the emotional wrestling with the patient. You get to meet a human being when he or she is at his most vulnerable. And you have unfettered access to the vulnerabilities, to what's most meaningful in a patient's life, and to make an impact. And the second aspect which I enjoy a lot about oncology is the fact that it's probably the single most dynamic field in medicine, that by the end of the year a lot of things change. The chemotherapy that we used to give, that I used to give as a fellow, changed tremendously. We're talking about molecular target therapy, about immunotherapy, clinical trials. Very much of that changed. So it's the human aspect and also the intellectual aspect. I'm not treating a patient, but I'm treating a human being. I think the single most important way of making a patient comfortable is just to listen. There was a study published years ago, a classic in the annals of medicine, that a physician takes approximately 11 seconds to interrupt a patient. So I like to ask a question. I like it even more to listen to the answer. We are building a comprehensive cancer program here. In other words, I want, when patients come to us, to be convinced that we are giving the best possible care, the kind of care they will get in any big center. Through our being part of the CINJ, of the Cancer Institute of New Jersey, we are a premier cancer program, and we have access through CINJ to clinical trials, to the latest CAR-T treatments, immunotherapy, bone marrow transplants, all that. Once a patient leaves my office, I want to make sure that the patient understands what's going on, that he or she had a chance to address all the questions, that I address not only the questions but also the family as a whole and the entire human being.